Everything you need to know about 1240 The Brew is on the Brewhouse website, 1240thebrew.com. 1240 KOKL, Okmulgee, Oklahoma.
SJ, welcome to Mvskoke Radio, your weekly source for tribal and community news, interesting guests and discussions, plus a local events calendar. XJ, Stongo, Gary Fife, Joho Jifkados.
Darren DeLaune, Geo Jifkados.
Welcome to Mvskoke Radio, Mabohedjit Owedskis. We appreciate you listening in here this beautiful Wednesday morning here in downtown Okmulgee. Quick sidewalk superintendent's look at the council house. It looks like they're done on the outside. It looks pretty good. How you say?
I'm enjoying it. I mean, they're moving along pretty quick, and I guess the weather's kind of helping them out. We might have had a few days with the rain, but other than that, I mean, it's going along pretty well.
Mm-hmm. Everything is inside, and they're working on the wall on the outside, so it's looking pretty sharp here. We have a lot of material here to share with you today. First of all, Darren has a special discussion coming up around a recent incident at the Mrs. America pageant.
Yeah, pretty much. Not the Miss America pageant, right. Mrs. America. So I had to correct myself the whole time. There was a little controversy that went with the Mrs. America pageant, and we're going to be speaking with one of my friends who wanted to address that controversy, and we'll go ahead and get her on the line now. Tanya, you with us?
Yes, I am. I'm here.
How you
Good
doing?
morning.
How you doing?
I'm doing great. I'm enjoying Albuquerque.
Oh, yeah, that's right. You are in Albuquerque. I forgot
Yes.
about that. It just slipped my mind. This is Tanya Wapskini. She works with the Cherokee Nation. And if I'm not mistaken, that's the diabetes program, correct?
It's a diabetes prevention program.
Diabetes prevention program. My apologies. Could you, in a capsule, could you please tell us a little bit about yourself?
Yes. I actually grew up in Stillwater, Oklahoma. And once I graduated and went to OSU and graduated, my first job was in Oklahoma City with the American Indian Association of American Indian Physicians, and it was in diabetes care at that time. And then the IHS decided to make the switch to prevention, so Cherokee Nation received a grant, and then I moved to Tahlequah, and I've been there for the past 12 years. And I have two sons, so I'm doing really good with what the Creator's given me. I also teach Zumba classes and spin classes at our gym.
Yeah,
so I'm just trying to help the community.
Exactly. It sounds like you got a busy schedule, and it's like not every other day, but every day.
And sometimes it feels that way. I think I get like 2 days off.
Yeah. So, okay. Well, I mean, there's a reason why we got you here today. Recently, there was a little controversy, like we just brought up, about the Mrs. America pageant that they had. Could you tell us a little bit about that controversy, please?
Okay. Well, the way I kind of stumbled upon it was a friend of mine shared a post that was made on the Mrs. Oklahoma pageant. And the post was congratulating Emerald Stanley, which is the Mrs. Oklahoma currently, and she won the favorite costume at the Mrs. America pageant in Vegas. And I believe this was at the end of August. In this post, Tracy Christ, she's the director of Mrs. Oklahoma pageant, she said that Emerald was representing her native tribe, the Caddo Nation. And then there was a series of pictures with it. The pictures were basically of Emerald standing in a silver bikini with silver sparkly fringe, which I didn't even know they made fringe like that. And then she has on knee-high boots, and it looks like stripper heels, if you've ever seen those. And then she has on a full-length headdress or war bonnet to some, and she's holding a spear. And so whenever I saw this and I saw the fact that she was thinking she was representing her tribe, then I shared it, because I think it's important for people to know that natives are not costumes, and this was a costume contest, and I was wanting to share it in the attempts of educating people.
You know, and one thing we can bring up, I mean, as far as I'm concerned, believe Gary can probably back me up on this, and also you as well. I mean, most women, American Indian women do not wear war bonnets or anything like that. I mean, even back then, with the tribes, I've never seen a woman wear a war bonnet. Have you?
I have not. My tribes, we don't wear war bonnets, so that wasn't something that I pushed against, but it's not respectful to the tribes that do.
Especially with what she was wearing. I mean, it was a war bonnet, but it was like bedazzled and everything.
Right, and that was my issue, is the way that she was portraying herself. It's sexualizing American Indian women. And at this point, there are higher rates in murdered and missing women, sexual violence, abuse. So with her coming on a national stage dressed like that, and it's making it seem like it's okay.
Yeah. Now, you talked about you whenever you came upon this incident that happened, you shared it. I mean, it was, of course, on Facebook and every other social media. What else did you do to address the controversy with the Mrs. America pageant?
Whenever I saw it, I sent messages I had links in my comments that directly linked to the Mrs. America page, and I asked people, if you feel like you need a comment on it, please do so, but please do not spread hate. This is to let her know that this isn't acceptable. But it doesn't have to be in a hateful manner. And then behind the scenes, I was messaging her and the director and giving them the information and sending them stuff about not Mrs. Oklahoma, but Miss Oklahoma. And because this was going on at the same time where Miss Oklahoma went to her tribe, this Chickasaw,
yes.
Yes, Chickasaw tribe, and had, I want to say, 8 artists design an outfit for her to wear for a shoe event that they were doing along with the pageant. And what she did was very respectful. There were things that were made for her that represented her tribe, and it was clearly a total opposite of what Mrs. Oklahoma was doing. So I sent this to Emerald. I sent this to Tracy. I also sent them links to the Leadership Native Oklahoma classes that are given by the American Indian Chamber of Commerce of Oklahoma, and that link was actually given to me by my friend Linda Sachs, because if she is claiming that she's from the Caddo Nation wanting to represent her tribe, then we do need leaders like her, and especially if she's on a national platform, then, and statewide platform, this would be a great opportunity to have a leader like her, and then at the same time, hopefully educating her on how to represent her tribe better.
Whenever you're emailing Tracy, Christ, and Emerald, were they trying to avoid the situation? Did it take them a while to get an email back to you or get a response?
I want to say it took a couple days for them to give me a response. Emerald has never opened her emails from me. Tracy, however, did, and Tracy responded. She sent me an email, and at first it was very negative, and she said, please remove the photos because she said that I stole them. And I reminded her that once you put things on Facebook in a public
form,
form, then they don't belong to you anymore. It belongs to Facebook. And she did say that they were copyrighted, and I said, well, I didn't take off the copyright. I mean, they're still your photos. And then she sent me copyright laws, and then she said that if they weren't removed, she was going to take action in 24 hours. And then she went on to say that she was actually going to thank me for being civil. Mm-hmm. So, and then it changed. So then I contacted my lawyer and some media reps that I know, and they basically told me that she didn't have a case because of the Facebook, because it was public.
Yeah. Now, I mean, I remember reading some of these responses, and one of them came from the Caddo Nation, the chief of the Caddo Nation, and she was saying that, that they did not wear those war bonnets or anything, or wear them anything like that.
Right.
Yeah. It was very, very amazing to hear, that, it reached that high of area. Even the Caddo Nation chief was making a response, making a
right.
stand
And I
against
even
it.
appreciated how they addressed the sexualizing of American Indian women, and the fact of her outfit was not something that they accepted or wanted to see. So that was I felt like it was very commendable for them to touch on or see it and then respond.
Exactly. What became the outcome of this everything that went on with Mrs. Oklahoma?
Okay, so then after she she asked me to take photos down, so I told her I would take her photos down, and I did. But there were other photos floating around, so I just replaced them. And then so she came back, and during the time, she actually apologized. She said that they were just trying to celebrate the beauty of Native Americans. And then I encouraged her to do a public apology. And then I sent her the link from, I sent her the link from Caddo Nation where they written the statement on their, on Mrs. Oklahoma. So whenever she saw that the pictures were still up, she said that she was going to pursue legal action. And then at that point, I was being so nice to her, and at that point, I was done. I didn't want to talk about it anymore. And so then I just dropped it, and I became angry because I didn't understand how she couldn't see that this was a problem. She still thought it was okay by this point, even with the Caddo statement. And she said, well, that's them, and, Emerald still feels this way about it. And so I wasn't going to argue with her anymore. And basically that was it. Well, then the next day, and after I was contacted by media reps, and they apparently got in contact with the director and Tracy, and they, asked her questions or fielded for information, that sort of thing, then I think Tracy might have gotten nervous that it was getting so big, and usually pageants or people in that type of light, they want to stay away from media and controversy. So the next day she contacted me and she asked me if I would help her with a public apology. So she wrote a draft. I gave her suggestions. She didn't take all of them, but she took some of them. So, and then she posted it and made it public.
Yeah, one of the things about it was, I guess they destroyed that costume. Is that
yes,
correct?
Yes, she did say that. She said that it was destroyed.
How do you feel?
Then,
Go ahead.
Oh, I was just going to say, she was, at that point, she was really nice. She even hoped that we could become friends.
Well, we hope that too, in a way. I mean, maybe, hopefully that, from then on, anybody who goes to that pageant, they just need to talk to their tribe first to see what would be the best way to represent them. That's what you're wanting to get out of it. Is that correct?
Yes. Just because, and then another girl at the same time, she says she's Cherokee. She was doing a photo shoot in a headdress, and it just so happened to be like on the same day that this other post came out, and they were very defensive, and and basically a group of friends and I and other people were saying, this is not Cherokee. You're not representing Cherokee people by wearing that. That is not how women dress.
Exactly.
So I mean, if anything is to be said about this, I think whenever you're talking to people that are wearing costumes or making a mockery or not misappropriating our culture, I think we need to be respectful to them, even because if we want their respect, we need to respect them as a human being, and then educate them. So I did hear a lot where there were hate messages and threatening people's lives. When you do that, people shut down. They're not going to listen to you. They're going to think, they're going to continue to think negative of Native population.
I wish, this subject could be, talked about for a long time. It could be
absolutely
talked about, because like we said, even with so many, you get like one little apology. There's like still maybe 2 or 3 people that will still try to do this and try to, justify everything. So.
Oh, yes. I recently, even after that, I posted, it was something that I posted last year, and it was just a picture that came, and it said something about a reminder for this Halloween season, or this Halloween, do not be Indian, do not be an Indian princess, do not wear Native American, whatever.
Yeah,
I can't remember all of it.
Yeah, we are not a costume, yes.
Yeah, we are not a costume. Yeah. So I have, actually, people are still commenting on this, and it's been over a week, and I believe it's up to 16,000 shares.
Yeah.
And it's reaching people that are not even in the U.S. It's globally now.
Yeah. As long as we remember, no princesses existed among American Indian culture. Yeah.
Right.
Yeah. So.
Right.
Tanya, we want to thank you very much for, we know you're busy. We know you're in Albuquerque right now, and taking time out of your busy day to be able to talk to us about this and what you did to be able to, get the Mrs. America organization or Mrs. Oklahoma organization to write to figure out what they did was wrong and write an apology about it. We want to thank you for telling us about that.
You're welcome. I was happy to do so.
Yeah. Have a great day, Tanya. We're going to take a quick break, and we're going to be coming back with a couple of public health nurses with the Mvskoke Creek Nation Department of Health. They're going to be talking about the recent
flu clinic.
The flu clinic that's going to be coming up. So please stay tuned with Mvskoke Radio.
I just got kicked out of my house.
My girlfriend just broke up with me.
I'm worried I might hurt myself. I feel so alone. Are you there?
I'm here. Here for you anytime, anywhere, 24/7. If you need help or know someone who needs help, please text CREEK to 741-741 from anywhere in the U.S. anytime about any type of crisis. A live trained crisis counselor will receive the text and respond quickly. No judging, just support during any type of crisis. Just text CREEK to 741-741. When suicidal behaviors are detected early, lives can be saved. Get free support at your fingertips 24/7 from the National Crisis Text Line. Help is available for anyone, anytime, anywhere. For more information about the prevention of suicide, or if you or someone you know needs help, please text the word CREEK to 741-741. This message is brought to you by Mvskoke Creek Nation Behavioral Health. Help support suicide prevention.
Welcome back to Mvskoke Radio. Gary Fife here, and we're welcoming to the studio Lauren Massey and Victoria Lowry. They're both registered nurses and public health nurses. They've got some degree there that we thought was worth mentioning. We are going to talk about the flu clinics, how the Mvskoke Creek Nation's Department of Health is preparing to help our people. First of all, thank you all for coming in this morning. We appreciate you making some time for us.
Yes, thank you, and for inviting us.
Okay, now, first of all, are you assigned to a separate department, a separate program? Is that the case?
This is Victoria, and I am assigned to the Sept Clinic.
Okay. Is that like a separate department, like you've got behavioral health and whatever else, the kinds of things there?
We fall under the Mvskoke Creek Nation Department of Health.
Okay. And Lauren, yourself?
Yes, the same. I'm at the Okmulgee Clinic, and we're separate clinics, but all together under the Department of Health.
Now, it sounds like you two are kind of the boots on the ground kind of people dealing with patients on a regular basis, daily basis.
Yes, we help within the clinic, but we also target the community. That's our role as public health nurses. We want to get information about and educate our community and help our tribal people be healthier and kind of help in their own education and health.
Sound like quite a challenge.
It is.
The flu season for 2017 is just about upon us, I would assume. First of all, let's take a look at the topic there. Now, is there actual flu season, or is it an all year kind of thing?
Flu season technically is all around every year. From year to year. Peak season, though, is around about February. It also peaks in December. That's when you're going to see the highest amount of flu within the community.
Yeah, Merry Christmas, you got the flu, right?
Yes.
The disease itself, the sickness, it's different from usually the common cold, right?
Yes, so the only definitive way to know the difference between flu and cold is to get tested. So if you have flu-like symptoms, fever, which doesn't always have to be, cough, body aches, just really not feeling great, you can go see your doctor and they can do a flu test and then determine if you test positive for flu or negative. If it's negative, you just have a cold, a virus. But if it's the flu, they can give you antivirals that'll help lessen the flu and make you feel better as quick as possible. But the best way is to prevent the flu with your vaccine and hand washing and good habits.
Either way, you feel miserable.
Yes.
Yeah. Okay. Right. Now the flu is the one that we hear about that could be fatal if carried to an extreme, right?
Yes. Within our Native American population alone, you have complications from the flu. Our Native elders usually contract pneumonia along with getting the flu, and they are at higher risk of dying actually from the flu. So that's why it's very important for our Native elders and especially our young children to get a flu vaccine every year. Along with other complications that unfortunately Native Americans are higher at is diabetes, heart disease, those types of things, and that puts our population at higher risk of contracting the flu.
And those two populations are the ones that are least able to fight it off, right?
Correct. They already have a weakened immune system.
Okay. Now, has your department compiled any research or statistics on how the flu affects our people? Is that kind of thing available?
It's not currently available. We are actually looking to implement a survey this year on our I can't even talk today, sorry, flu mobile clinic. And that's going to help us kind of compile our own data within the tribe, and we can use that data to kind of see what areas we may be lacking, how we can challenge those obstacles, and what we can do to move forward.
Now, it would seem if it's hitting our population the hardest, there might be other factors that would contribute to the situation, like social conditions, lack of income, lack of proper housing and sanitation, the kinds of things that we are familiar with, unfortunately, but they play a part in whether or not you are more susceptible.
Yes, so the CDC definitely recommends the best way to prevent the flu is to get the vaccine every year because the immunity kind of wears off. So you want to do it every single year. And it takes 2 weeks for the vaccine to build up your immunity. So we said the peak season's in December, so if you wait till December to get it, for one, you might already been exposed, but for two, it takes a couple of weeks for your immunity to build up. Also, washing your hands often. If you can't use soap and water, use alcohol-based rubs. Cover your mouth with your elbow or a tissue. Avoid close contact. If you're sick, stay home. I know it's easier said than done, but nobody likes calling into work. But then you're not spreading the flu or a cold or viruses just in general. So try to stay home, clean and just disinfect frequently touched surfaces, our cell phones, doorknobs, phones, land phones if anybody has those anymore. Sleep, water, your intake of food, so healthy foods that make you feel better. Those are just all that everybody knows and preaches all the time, but easier said than done, I know.
Oh boy, in the morning though, it's real easy to stay in that nice, warm, comfortable bed, in particular if you don't feel good. The controversy over the last several years has been around vaccines, their use and their content. Is there a special kind of vaccine that your department has chosen to use, and should that dispel some of people's anxieties?
We actually have what is considered a quadrivalent, and what that means is it has 4 different strands of flu. It is developed by the CDC a year in advance, so it may not be completely accurate and perfect, but it is a start, and they usually take those strands from previous years that may have been higher or lower. It's a complicated process of trying to figure out which strands to put in each year, but like I said, we tried to pick the best that we could. So the quadrivalent, like I said, is the 4 strands. It's 2 strands of A and 2 strands of B.
And should that alleviate anyone who's a little anxious about getting a shot?
I think so. One of the things that a lot of people have to remember is that you're not going to get the flu from the flu vaccine. These are not live viruses that we are giving you. They are inactivated viruses, meaning they're not a living virus. So you're not actually going to get the flu from the flu vaccine. It actually helps to give you that immunity that you need to prepare your body to take on the challenges that the flu is going to try to throw at you.
How is the Mvskoke Nation doing? Are we coping with it fairly well, about average for the average American? Does it hit our people harder?
I think we are preparing very, very well, especially with, providing immunizations within the community with our flu mobile bus. That kind of helps with what is called herd immunity, or some people may not understand what that means. So what it means is community immunity is probably the best way that I can describe that. So kind of my vaccination, your vaccination is going to protect the next person and the next person. So we want to try to create that herd immunity, and that's one of the reasons why we provide the flu mobile bus.
All right, we'll get to that in just a second, but herd immunity now, that's if you're in that herd and somebody gets sick, the chances of you getting it are pretty good if you're not ready for it and a little lax in your hygiene.
Correct.
And
so you want to make sure you're getting that flu shot, and everyone in your community is getting the flu shot, because it gives you that protection that you need.
I'm one of those folks who doesn't like needles that much, but I have to deal with it. Does it really hurt? I mean, is there something there?
It kind of depends on how you handle pain. I can't say that it's going to be completely hurt-free. It has its normal side effects like any other shot or that you may get. Maybe you need a tetanus shot. Maybe you need a antibiotic via shot. I'm not going to say that it's pain-free completely, but it does have, the normal side effects that any other shot has, redness at the site, some pain. We encourage you to take Tylenol for that. Other than that, there should be no other side effects from it.
You keep the patients around after the shot is administered just to kind of check up on that sort of thing?
Yes, so it's we try to get you in and out as quick as possible. So there's a consent you fill out. We give you the shot. If this is your first time ever getting the flu vaccine, we'll ask you to hang around for about 15 minutes after giving you the injection. If you're going to have a bad reaction, meaning needing medical intervention, it's going to be within those first few minutes after the vaccine. Other than that, it's going to be very mild things like Victoria said, just the redness at the site. If you get a flu vaccine every year, usually just hanging around 5 minutes after. By the time you get your things back together, you should be good to go. So we're trying to get you in and out as quick as possible.
So I would try not to get punched in the arm at the same spot, then, right?
Right.
The reaction now, if someone is, going to have a reaction, what kind of signs might you want to look at?
Serious reactions are very, very rare. It very rarely happens to anyone who gets the flu vaccine. Most of the time, it may be someone that may not know that they're allergic to eggs, or maybe they're allergic to something in particular and they weren't aware of that. They've never been tested for it, or maybe they hadn't ate that particular food, whatever it may be. But they are very rare. Usually it'll be anaphylaxis, which is like the closing up of their throat, things like that.
Isn't that kind of the same thing if someone is allergic to a bee sting or something?
Correct.
Okay. Now, I've been stung by enough bees, so I guess I'm immune to that, but it doesn't mean you like it. Now, what is the motivation for putting your clinic on wheels and traveling around the communities?
So as part of public health, it's going to the public. It's saving patients from coming to the clinic. So with our mobile bus, we will be at multiple areas in all of our jurisdiction. It's a pretty busy, heavy traveling month for us, but we go to our people and our employees of Creek Nation to take the flu shots to them, because we know everybody can't get away from work, can't make it to the clinic, transportation, anything like that. So as part of public health, it's going into the community to better serve our people.
Now, who is eligible?
So it is free to all Native Americans, adults ages 18 and older. Our mobile flu does not do children, so 18 years and older.
Okay, so you show up, perhaps fill out a form, and get in line.
Correct.
The probably interest is being raised there about a schedule for your clinic. Now, they'll be looking for a beautiful blue and blue bus there with your symbols on the side. Now, kind of give us an idea of when and where you'll be starting and that kind of thing.
So our bus may not be at every single location, but starting October 9th, we will be at the Tribal Complex here in Okmulgee, and the bus will be there. And then we have a schedule that we've emailed out to all, even casinos. We go to pretty much all of our casinos, so they should have a schedule hanging up most places.
Read it. Yeah, that's okay. We can
Also,
whisper just like Dune.
we'll be going to the college, and then our pink party is at the Dome on September 25th, and we will be there the whole time giving flu vaccines. So hopefully you can see a schedule somewhere when you're out and about and find a date to come see us.
And if they were to contact or go straight to the health department, is available somewhere there?
Yes, you can also see your primary care at any of the clinics. And you can just schedule a nurse visit. You don't have to actually see your doctor. You just say, I want the flu vaccine, and a nurse will see you.
Well, that simplifies things greatly. Then the effort is wonderful. Now, have either of you been on the road with this tour before?
Well, actually, this is our first year as public health nurses. We've came into our positions just in the last probably beginning of the year. We've both kind of been in different positions within Mvskoke Creek Nation Department of Health, and so this is new for us. It's a new process for us. It has been done in the past before with other public health nurses, and they've never had a problem. And so we're looking forward to a new adventure as public health nurses, and as public health itself is expanding its horizon.
Oh, that's wonderful, reaching out into the community so those folks don't have to come all the way to Okmulgee.
Correct.
Okay. The first date, as you mentioned, is October the 9th, and it runs through the end of the month, wrapping up at the Tulsa Indian Community Center with all of the communities in between. Now, if someone were to show up and ask about it, what kind of procedures do you go through?
Normally, it'll just be like the normal process. They'll sign a consent. They will go through all of the questions that we ask to make sure that they are eligible to get the vaccine, meaning maybe they're not allergic to eggs, or maybe they're allergic to latex or something of that nature. So we want to make sure that we are medically taking care of them on that side and not giving them something that will harm them. So they'll fill out that consent form. We'll draw up the vaccine. We'll give them what is called a VIS. It's information specific about the flu vaccine that they can take home and read, or they can stand there and read, if they want to read the whole thing, whatever they would like to do. We can hit some high points specifically about the flu vaccine at that time, and we will administer the vaccine, and usually they'll stick around, like I said, if they are allergic to it. We'll figure it out in the first 15 minutes, and if they're not having any symptoms of allergic reaction, then they're free to go.
Any cookies and juice while you wait?
No, we don't want to encourage too much juice because we're diabetics.
Now, the whole thing is wonderful that you're able to get out there and bring the medicine to the people like this. The schedule, of course, as we say, begins on the 9th here at the Tribal Complex at 9 a.m. and just for that morning, right, 9 to 11:30. So after that, they're going to have to go somewhere else, right? What about somebody who might have the flu already or something like that? Would you go ahead and treat them? Would it do any good, by the way?
Well, it kind of depends, actually, because some people may have the flu and not realize that they have the flu. They may not show symptoms at that time. And if they're not showing symptoms at that time, we may go ahead and administer the vaccine because they are not showing any symptoms. And like we said before, it takes about 2 weeks to develop an immunity for the vaccine. So within that 2-week time frame, they may go ahead and develop the flu. Again, it's not from the flu vaccine that they're getting the flu. It's because they have already had it in their system. And unfortunately, they will be contagious probably during that time and probably have spread it to other people, not realizing that they've had it already.
How easy is it to spread?
Just from me and you talking right now.
Oh, gosh.
It's one of those, it's a respiratory illness. It's spread droplets, so coughing, sneezing, talking, at least 6 foot away, you can get it.
So if I were to sneeze at Brooks, then the chances
Yes, or if you sneeze on the desk and then he touched it with his hands and then wiped his eyes or wiped his nose.
Okay, that would probably be the end of Mvskoke Radio. Hey, get out of here. We don't want that. Okay, now, I'm sure there are people who are going to have questions, I would assume particularly about the schedule. And once again, if they wanted to see the schedule, and then if they wanted to contact you for more information, where would they go? Who would they talk with?
They can call any of the clinics that have a public health nurse, which they can call the Sept clinic, they can call the Okmulgee clinic, Eufaula, or Okemah. We have public health nurses there, or they can actually just call their provider and ask specific information. They should have that available, but they can ask to talk specifically to the public health nurses, or they can ask to talk to a nurse.
Right. Now, before we let you go, Oklahoma has indeed recorded fatalities from the flu, is that correct?
Correct.
And so it's nothing to be taken lightly.
Correct.
Thinking, oh, well, I'll get sick for a while, stay in bed, and I'll be okay.
Right. It is more common for healthier adults to recover better from the flu than people with complications. But it is strongly encouraged that, to take those steps to get your flu vaccine, to wash your hands, if you do get it, take your antivirals, that type of thing, and seek out, help if you need it.
Okay. Anything else coming up in the future that you might want to kick out there real quick?
We have our pink party coming up. That's hosted by the Mvskoke Creek Nation Department of Health, and that is for breast cancer awareness as well, because October is Breast Cancer Awareness Month, and we encourage everyone to come out and take part in that, as well as getting a flu vaccine there.
All right, wonderful. Thank you so much, Lauren Massey and Victoria Lowry from our own Mvskoke Creek Nation Department of Health. We wish you a lot of success with this campaign, and thank you so much for coming down to share this information.
Thank you for having us.
Okay, we'll take a short pause here on Mvskoke Radio, and then we're going to bring in our crew to give you a little bit of an election update. So stay with us here, Mvskoke Radio, here on 1240 The Brew.
Hello, this is Principal Chief James Floyd of the Mvskoke Creek Nation. The excitement of football is in the air, and the nation supports all our local high school football teams and looks forward to all the excitement and action of Friday night. It's our prayer that all the athletes play hard and remain safe this 2017 football season. So from the Mvskoke Creek Nation, go team!
I started doing it when I was 11. I wanted to be just like my big brother. And some of my friends were already doing it. We got hooked fast. I just can't get enough. I'm Jacob, and I'm addicted to playing the drums.
There's lots of stuff that makes it cool to be Native. Doing meth isn't one of them. Find something better to do. Check out ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
Who am I? Am I Native? I don't want people assuming things because I'm Indian. I just want to be me. But how do I live in two worlds? Some guys just check out by doing meth. But that ain't for me. Because I see my family, my friends, my drum making, my future. There are a lot of cool things about being who I am. And meth isn't one of them.
Learn more at ncai.org. A message from the Partnership for a Drug-Free America and the National Congress of American Indians.
One Fire Casino in Okmulgee offers Ladies' Day every Monday with $5 match play, VIP days for seniors on Tuesdays, lunchtime match plays on Wednesdays and Thursdays, and several other great drawings and prizes throughout the weekend. Don't forget to take advantage of spinning the wheel on Sundays to win up to $5,000 cash. Be sure to check out the daily meal specials at Council Oak Cafe. There are exciting monthly giveaways with extravagant prizes. Come and play at One Fire Casino, where it really is okay to play with fire.
Welcome back to Mvskoke Radio here on 1240 The Brew. We've got our Mvskoke Media crew coming in now. We hope that you all were aware and took part in our recent tribal elections, the primary. So we've got our crew coming in to discuss it. First of all, Liz Gray, who's our reporter for Mvskoke Nation News. We have Kevin Barnett. He's fiddling with the camera right now, but we're going to put him on the spot. And Darren DeLaune, who's still talking to our previous guests, and we'll get him in here in a second. First of all, Liz, was this your first election coverage?
Yes, yes. As a reporter in this capacity, that's the first time I've ever been able to report, which I was really excited about because I'm a numbers girl, and I like to look at the results and how it comes in, and just to see kind of how people vote. You know, maybe pick up on some trends, or like the different precincts throughout the districts, and I've been having a really fun time with it.
So watch it unfold right before you.
Yeah.
Okay, now Darren and I co-hosted the live stream coverage. That was kind of fun, wasn't it?
It really was. I mean, I enjoyed it. I mean, it was just trying to get ready for the live stream. I mean, I'm glad we were able to do that 30 minutes before the polls closed instead of like say for an hour. I mean, that would have been tough. But I mean, being able to give the people what they wanted, and they were wanting the results of the election. I mean, they were wanting it kind of right away, and we were able to give that to them like when we knew they knew. So that was a very cool thing to share with our citizens.
As far as I know, that's the first time this particular topic has ever been done like that.
Yeah, I mean, like I said, whenever I used to do it, I mean, all I did was just update it on the website. That was it. It wasn't no talking, nothing like that. Nothing what we done. I mean, nothing what all of us done here at Mvskoke Media. But the live stream, yeah, as far as I know, that's the first.
Okay.
Yeah.
We also want to welcome to our studios today Kevin Barnett, who still was a rookie when he started this, but we gave you a real baptism of fire on this one, right?
Yeah, I did. I was a little nervous going into it. I think I mentioned to everybody here that I've never really taken much interest in tribal politics, but leading up to the election and just finding out everything that the information people were willing to share with me, and getting caught up on the candidates, it was interesting. It was an experience.
You weren't alone on being that nervous. I think we all were too.
I think we showed up to the live stream to start the live stream, we were like, oh no.
Not knowing what to expect.
No.
What are we doing?
What are we
doing?
Yeah, we were so nervous, like everything's going to go wrong. And then it went smooth.
Yeah.
Okay, well, being the old veteran here, I've done a few of these things and knew what to expect, but I have to hand it to you all. You came through it beautifully. I mean, everything was smooth. Minor technical glitch at the top of the show, but it wasn't our fault. But when we got rolling, it was great. I mean, everything clicked right on time. Even our prize giveaways worked well.
Worked out really, really well, yes. Another thing, too, I mean, not only we had our technical producer for that, for Native News Today, Jared Moore. He was a big help, just trying to kind of steering us in the right direction. I mean, we had our information ready to go. And then to top it all off, I mean, Liz was there, getting everything, getting the info to us. And also Kevin. Kevin got to go to Solomon McCombs building to be able to go to talk to the people that were around there waiting on the results, just like us,
That was another thing that surprised me was I didn't realize that this was the first time that you guys live streamed it, because when I was at the McCombs building, I was watching on my phone and as often as I could, and it seemed pretty seamless. I mean, it looked like it looked to me like you guys had done this previously. So
well, while you were there, I guess this was your first time in doing that, I guess, right?
Yes, yeah.
Okay, how did you feel? What did you see? What caught your attention? How did it work out for you?
I think the main thing that caught my attention was just the interest from the citizens that showed up, and some of the dialogue that was going on. I kept telling myself I'm not here to eavesdrop, but I kind of was there to eavesdrop.
Well,
spoken like a true Creek.
Or spoken like a true reporter.
Yeah.
You kind of keep that ear open and pick up what you can.
I think the biggest, and another one of the things that kept coming up was just amongst the people that were there was just how fast the election results were coming in. And, I think whenever the first district to, I guess, finalize the results was Okmulgee County, or Okmulgee District.
Absentee with them.
It was
the
absentee.
Absentee. Okmulgee right behind them.
Well, no, Okmulgee was a little bit, I'm not going to say probably in the mid part, which was kind of shocking, they're right across the street. But it was it was the other districts that were coming in. I think Okmulgee came in about midway. I'm going to say probably around 7:30, 7:45.
Right, we saw, I think, the rural district numbers starting to come in.
Yeah.
Speaking of which, let's take a moment or two. Liz, you've got some unofficial numbers here. I believe they still have to wait until Friday till the protest period is over.
Right. Yeah, we have unofficial numbers for 2007 for the 2017. What it's looking like, for each district. I mean, we can go down to we had some winners that are going to be they're just going to bypass the general and they're going to be sworn in. I don't know the date exactly. January.
It should be in January.
January is what I'm assuming, and that's now unofficially. I have to stress unofficially. Not this isn't, but Mark Randolph for Wagner County. He's going to be Adam Jones III and Joyce Steer. Which is interesting because we knew that the ones that had the two candidates, McIntosh and Wagner, that we were going to have a winner. But I don't think we were expecting Mvskoke, because Joyce Steer won Mvskoke, and she had three. There were three candidates, and she ended up winning because she had that 50% plus one.
Right.
That's pretty cool to hear. I mean, especially with the three candidates, because chances are, I mean, more than likely, I mean, we had another district with just three candidates, this Creek District.
Yeah, Creek District.
They're going to have a runoff. But with the Mvskoke District, they had those voters come out. They had one that they wanted in there, and like Liz said, it was that 50% plus one vote.
50% plus one is how you win in your district. And Joyce Steers, I mean, I think she got more than just the plus one, but it was 50%.
Liz, if all possible, I think. Do you have, I guess, the total number? I know it's unofficial right now, but do you have the total number of votes for maybe each district by any chance?
Yeah.
And you can just rattle off a few if you wanted to.
Yeah. I'm just going to keep it pretty in the estimated. In each district had about 3,000 votes. Every one of them had 3,000 votes. People they came out. They came out, which is. it's cool to see because based off what I could find, because there's no real numbers on file from the last Seat B election, which was 2013. Roughly it was 2,300. And that's based off of our archives of reporting. So you can see that there was a jump from the Seat B, last Seat B in 2013 to the 2017 Seat B.
So more voters were turning
Yeah,
out.
we had a good voter turnout in comparison.
On that voter turnout, though, was there like I'm gonna say, was it the same number? Let's say, for instance, Okmulgee was the same as Tulsa or Muskogee. Were they like the same numbers, I guess, in voter turnout?
Are you talking about
total
for this election?
For this election, yes.
That's interesting because I thought whenever I was looking at these numbers, I just need to get one district and I'm adding up and that's the total number of voters, and that's not true. There's different like variations. Like Creek County had 3,144 votes, and then McIntosh County had 3,097. So there's a little bit of drop off. I mean, it's not too significant, but it is something to look at to see how Creek voters are voting. There's questions of if they know that they can vote in their county, or if maybe they are like, I don't like this candidate, so I'm not even going to fill it out.
If I'm not mistaken, this is kind of a fairly new thing too, right? Is where they get to vote for every district. If I live in the Tulsa district, I get to vote for all districts, right?
Yeah, in this last one, and that's something to look at too. 2013 was before the at-large voting, where you could only vote in your district.
Right. And Kevin, you're correct in bringing that up. I think it used to be where a particular politician had their own little collection, their own nest of voters, relatives, if you will, or their buddies and things like that. They could always count on that block choosing them over anybody else. It doesn't matter. I mean, so and so is my uncle or my cousins or whatever else, and they were there. But now when they've opened it up, then I think it bodes well for our people that now all of us are beginning to choose our leadership and to make sure that we've got the best candidate going in. Any thoughts there, folks?
I think that's probably a good thing, because I was going to do a story about this transportation to the polls, and the transit center, I can't remember who I was speaking to over there, but they let me know that this year they didn't get any requests for transport. So again, if what you just mentioned, if they had that block of family members, relatives, friends that they could count on for votes, it was kind of in their benefit to provide transportation. But since it opened up to just citizens as a whole, then it kind of, I wouldn't think that would be as beneficial anymore to provide transportation for, say, for Wetumpka residents to the polls, since people in Muskogee are also going to be voting for me or against me.
Right.
So.
Well, and whenever we did the voter apathy story, we also noticed an increase in absentee voters, which was just a replacement of people going to the polls, and that might have been why we didn't have so much transportation, because maybe people just got it in the mail and sent it off because it was easier to get it in the mail and send it off.
That's one good factor to put into that as well. And also, you might want to look at it. There might be some other little things that they might, will they keep driving out to some certain areas, or are they going to drive out one time a day at a certain block of time, being able to look into that. I know there's a lot of things that you have to look in, say, for instance, for those ride to the polls.
When I first heard about those, that was my first thought was logistics on providing those rides, because I know in the rural areas, that's kind of a task to take on. So
yeah, considering the condition of a lot of those roads.
Yeah,
big mud puddles. The numbers, as you say, came in quickly. In my ancient days as a reporter in Alaska, we could be there at least until like close to midnight before the final numbers were counted. And, of course, our poor crew had to do an all-nighter in preparing all of that for the hosts in the morning. So next day we were home and sleep. But this time it turned out pretty quickly, and we saw some trends starting to develop. There were some familiar names who were trying to return to the political scene, and then there were a few newcomers. We saw the southern districts counting their numbers quickly, and then in the north, the population centers like Okmulgee and Tulsa, they were slower. I don't know, perhaps due to sheer numbers or something like that. I don't know. First of all, let me give a hats off to our election board people for cranking those out. I mean, it made my life a whole lot nicer.
I mean, what did we buy? Was it 8:30 or something like that? Wasn't all the precincts reported in? I mean, and it was cool seeing that little check mark right by when we were looking on the screen and being able to tell the citizens about that. You know, we were able just to announce like, okay, Yardika checked in, Mvskoke checked in. You know, we were able to say that. That was very, very cool. I mean, seeing that.
Yeah, yeah. Hannah and the sleepy dog checked in. We have you finished the numbers, the list of numbers here?
Yeah, I didn't want to just go off and ramble into it. I think that one thing it should be, we're putting out some information about some past elections, and the 2015 was something that I wanted to address. We did have a bigger voter turnout in the 2015 election, probably about 4,000. They said that the final number in the primary, it was probably about like 4,700. But it should be noted that this was not only a national council CA election, it was also principal chief. So maybe, you know, and that has a lot to do with voter turnout. So anyone reading these stories and sees that there's a drop in voters, that's probably because of it was a principal chief election as well. Not to say that it's less important, but it does tend to be, you know, a bigger election.
Well, you see more people knocking heads there, I think.
Yeah, because, you know, you see the big position of principal chief.
Okay, well, I tell you what, anybody have any final thoughts here? Then we're going to get on to a few community announcements.
One more thing I'm going to bring up that precinct and absentee registration has opened up today, September 20th. So if they weren't able to vote in the primary election, the general election, they can vote in there. If they're not registered, that's when, I mean, now's the time to do it. Now's the time to go ahead and get ready to vote in the general election, because, those have, the registration has opened today.
Right.
One more thing. If you are a registered voter, I just really encourage you to get out, vote, encourage your family to vote.
Yes. Those qualified voters. We don't any phantoms in there. Okay, well, remember that the big one's coming up November the 4th, and then we're going to see all of these folks chosen or told to go home.
We're doing the debates too, the general election debates. Mvskoke Media will be covering the general election debates. We're going to be getting those dates out here pretty soon.
Right, so we have intensified our coverage, and so we hope that our citizens and listeners can follow us. All right, first of all, go ahead. We'll
go ahead and start this off. We got a Macy's job Monday, a little job fair, Monday, September 25th, 2007, this 10 a.m. to 2 p.m. Apply online at Macy's, MACYSjobs.com.
We have a revival at Bicasita United Methodist Church. Let's get revived September 25th, 26th, and 27th at 7 p.m. For more information, you can contact Gloria Lowe at 918-645-7426 or would go along at 918-616-0381.
And the Tulsa American Film Festival is happening October 11th through the 15th. They're having a Will Sampson retrospective leading into the festival. They are having also a showing of the outlaw Josie Wales at the Philbrook, One Flew Over the Cuckoo's Nest, and Poltergeist 2.
Okay, last but not least, the taco dinner we told you about, it has been changed slightly. Still Springdale Baptist Church coming up, but they've changed their price from $2.50 to $5.50. That's get a hold of them by the 8th. We're out of here. Thanks for being in here with us. This is Gary Fife saying, Mabu Hedges good. You've been listening to Mvskoke Radio. Join us again next week for more local, tribal, and community news and updates. Madam.
On the air, on your phone, and on